double-sided. I grabbed the wrong first. Does that refresh your recollection as to the date you would have seen Danny Millett?
Yes.
All right. What date was that, sir?
December 5th, 2017.
And what brought you to contact? If I can have that back. What brought you into contact with Mr. Millett?
I did the initial history and physical of him in the emergency room.
And what were your findings on that initial history and physical of Mr. Millett in the emergency room on December 5th, 2017?
He appeared to be suffering from septic shock.
What, if anything, did you do after that diagnosis?
He was intubated in the emergency room, if I remember correctly, placed on blood support medications, antibiotics.
All right. And was he admitted to the hospital thereafter?
Yes.
Do you know what, if any, unit he went to after the emergency room department?
He was admitted to the intensive care unit.
All right. Did you have any care for him while he was in the intensive care unit?
Not directly, no.
All right. At some point, did it come to your attention that Danny Millett died that same day?
It would have come to my attention the following day.
All right. And tell us about how that came to your attention and what, if anything, you documented regarding the death of Danny Millett.
The following day, I would have followed up on him as my patient and would have discovered that he died the night before.
Okay.
Would have reviewed my partner's notes, and that would be it.
All right. Now, we've heard from several doctors, I believe, that were actually also in your group and other hospitalists that have had similar involvement with different patients. It's been testified that...
Finish the question.
That if you are the attending doctor, you write the discharge summary when a patient passes in the hospital. Is that your understanding of how things should be?
Overruled. You can answer the question.
Typically, that's how it would work, yes.
All right. Were you Danny Millett's attending physician?
I was the physician from my group that saw the patient on arrival. The attending physician is assigned per the group. So it's, depending on the next day. So the next day we would come in, divide the patients up. Most likely he would continue to be on my service simply because I have a history with the patient and saw the patient the day before.
All right. Were you listed in the medical records, though technically has the attending physician for Danny Millett?
I don't know.
If I were to show you that history and physical, would that help refresh your memory as to who was the assigned attending?
The history and physical would not be what tells you who the attending physician is.
All right. Did you write the discharge summary for Danny Millett?
I did not.
Who wrote the discharge summary for Danny Millett?
According to the records, Dr. Jenny Varghese.
And who is Dr. Jenny Varghese?
She was one of my partners at the time.
All right. In the medical group with you?
Yes.
And one of the people that would be on that schedule to be assigned patients?
That's correct.
All right. And to your knowledge, based on your review of the records, did Dr. Jenny Varghese actually ever see or do anything with Danny Millett on December 5th or at any point in his hospitalization?
Not to my knowledge.
All right. Nonetheless, she wrote the discharge summary for him?
Yes.
All right. What is your understanding about a doctor being allowed to sign a death certificate if they have actually not seen the patient in the hospital?
That's typically not how we practice.
All right. At some point, were you asked, because you had seen Danny Millett in the hospital on December 5th in the ER, were you asked to sign the death certificate?
Yes.
Showing you what I'd marked for identification purposes, has States Exhibit 18, D as in Delta.
Yes. Appears to be it.
Permission to publish, Your Honor?
Any objection?
No, Your Honor.
Go ahead.
Showing 18D. Goes to
Did someone turn off
autofocus,
the
Judge.
self-focus?
All right. There we go.
There you go.
All right. And what does 18D appear to be, Doctor, starting at the top?
The death certificate.
All right, and do we see your signature here on 18D?
Yes.
And there should be a laser pointer up there. Could you point that out to the jury?
Up there? That's
There
my
you are.
signature.
All right. And as part of signing this, did you list any cause of death?
I did. I listed as sepsis caused by bacteremia.
All right. And what is that cause of death? How did you come to that conclusion that that's what he died from?
Well, through my history and physical and care of the patient, we've discovered that he had septic shock and his blood grew bacteria.
All right. Before signing the death certificate, referring back to Joint Exhibit 4, did you go back and thoroughly read every page of Danny Millett's medical record for his admission on December 5th?
No.
Did you at any point look in the medication administration record and find out how much narcotic pain medication and benzodiazepines he had been administered during a palliative extubation prior to his death?
No.
Regardless of your review of the medical records, were you ever aware, prior to signing or making that determination, sepsis and
Bacteremia.
bacteremia caused his death, were you ever aware that of the amount of narcotic pain medication and or benzodiazepines that he had been administered during the palliative extubation?
No.
Thank you. I have no further questions.
Cross?
Do you want these up here? Yeah, just the test. Okay.
Afternoon, everyone. Your Honor. Counsel. Good afternoon, Doctor.
Hello.
I want to start first with the death certificate, and then we can work backwards from there, okay?
Sure.
I'm referring to State's Exhibit 18D. Doctor, can you see that?
Yes, I see it.
Now, prior to writing that death certificate, is it fair to say that you reviewed particular portions of Mr. Millett's medical record?
Yes.
And that would include your history and physical, correct?
Yes.
Would that also have included the discharge summary done by your partner? I'm going to mess up her name. Ms. Varghese?
Varghese.
Varghese, I'm sorry.
That's correct. I did.
Okay. So it was based upon your review of the documents you felt were pertinent that you then signed this document, correct?
That's correct.
And you would agree with me that you don't just sign a death certificate in jest, correct?
Correct.
It's a very important document, right?
Yes.
And in preparing to sign this important document, you didn't randomly select parts of the medical record that you felt you needed to review prior to signing this, correct?
I did not.
You went to where you felt you can get the relevant information to determine what was the immediate cause of death for Mr. Millett, right?
Yes.
And based upon that, I notice here you put CAD here. That's coronary artery disease, correct?
Yes.
And isn't it true that you cannot put a heart attack as to the immediate cause of death in these first two boxes, correct?
You can put myocardial infarction, which is a heart attack. What you cannot put is cardiogenic shock or a mode of dying. You can't put that.
So you couldn't put necessarily that, an arrest, and correct me if I'm wrong,
That's correct. You cannot place cardiac arrest.
and that's because naturally when someone passes away, it's when their heart stops, correct?
Yes.
So everyone's death certificate would then have arrest on it, right?
Potentially, yes.
So it was then, based on your review of the medical records, that you determined that based off of Mr. Millett's history of cardiovascular disease, that he then suffered sepsis and bacteremia, which caused his death, correct?
Would you repeat that, please?
Yeah. Because you can't put arrest, the heart stopping on this death certificate, you put what led to his heart stopping, correct?
That's correct.
And that would have been sepsis and bacteremia, correct?
Correct.
And correct me if I'm wrong here, doctor. You can die from sepsis by itself, right?
Yes.
And you can die from bacteremia by itself, right?
Yes,
And you can die from coronary artery disease in and itself, correct?
yes.
Do you recall from your review of the history and physical that you offered, as well as a discharge summary, that Mr. Millett actually suffered 5 cardiac arrests in his time at Mount Carmel that day?
I don't recall the exact number, but there were multiple times, yes.
And he coded each one of those times and was resuscitated, correct?
Yes,
And each time he was resuscitated, he required more life support to bring his pulse back, correct?
I'm not sure that I can clarify that one way or the other.
Do you recall from reviewing your history and physical that you actually had spoken with Mr. Millett's wife and son at his bedside after he had suffered those arrests?
I documented that I did that, yes.
Do you recall also that he had an elevated lactate, which would be indication of acidosis, right?
Yes,
So he had multiple arrests, correct?
correct.
Liver failure, correct?
Yes,
Sepsis,
yes,
respiratory failure,
yes,
and his family witnessed all that, didn't they?
I can't say that they witnessed it, but they were aware of it.
Doctor, do you recall speaking with a physician by the name of Vorbroker?
I recall that I reviewed that in my records, that we spoke, yes.
Okay, and just for clarity, I'm referring to the emergency urgent care note. Is that the same one you're referring to that you reviewed?
Yes,
Okay. I'm going to refer to Joint Exhibit 4, pages 34 to 37. Doctor, you see here that that is Mr. Millett's medical record, correct?
yes,
And this is Mr. Vorbroker, correct, this note?
that's Dr. Vorbroker's note, yes.
Okay. And just to lay the foundation here, doctor, that would be your name here, where it's indicated that this doctor spoke to you?
Yes,
Okay. And in part of that conversation and what you reviewed, you learned that Mr. Millett had actually been at Mount Carmel the week prior to this, correct?
that's correct.
And he had actually been brought by, I believe it's referred to as a squad, but he was brought by an ambulance, right?
Yes,
Is an emergency because he was unresponsive, right?
yes,
And he had to have certain procedures prior to his discharge a week before this incident, correct?
that's correct.
And that in between that date and the date of December 5th when he came back, he was actually receiving pain medications at a facility for his various ailments, was he not?
I can't confirm that, but that's what the records show.
And you see here in this note, after the conversation with you is referenced, that his family was present outside the room through his numerous arrests?
I see that.
And that, based off of this emergency room doctor's prognosis, that he was extremely ill?
Yes,
And again, this was something that you reviewed, as well as the discharge summary and your own history and physical, when you made the determination, again referring to States 18D, that this man died of these things, correct?
that's correct.
And one last question. Regardless of any assumptions of the good intentions of your colleagues or not, had you wanted to review the medical administration record, you could have, right?
Yes,
Thank you. Nothing further.
Redirect?
So of all the things you can die from, are you aware, is it within your medical knowledge that a person can die from being overdosed on fentanyl?
Objection, Your Honor.
I'll permit it.
yes,
Can they die from being given too much fentanyl and benzodiazepines at the same time?
yes,
But you didn't look at the medical record, the medication administration records?
no,
Do you assume good intentions in your colleagues in their medical care?
yes.
Nothing further.
Okay, you may step down. Thank you kindly, doctor. Call your next witness.
The State House Jordan Blair. Thank you. Thank you.
I'll need you to remain standing. Raise your right hand. You swear or affirm to tell the whole truth, nothing but the truth, so help you God?
I do.
Thank you. Please be seated. Take a second. And if you would be so kind as to state your name for the record and spell your name, please.
My name is Jordan Blair, Jordan Blair.
Thank you.
Yep.
Good afternoon, Mr. Blair.
Good afternoon.
Where did you grow up?
Lebanon, Ohio.
And where did you go to school after high school?
I went to Capital University in Bexley.
What was your major?
Bachelor's of Science in Nursing.
Why did you choose nursing?
I just wanted to be a nurse ever since I was a freshman in high school. I had dreams to further my education and then, go on to grad school and become a CRNA.
What year did you graduate?
High school or college?
College.
2017.
And what was your first job after graduating nursing school?
My first job after graduating nursing school was as a nurse, was at Mount Carmel West in their ICU.
When did you start there?
I started there in, I believe it was October of 2017.
So what did you do between graduation and October?
I was studying for my NCLEX and just working part-time construction, and just, yeah.
Why did you pick the ICU at Mount Carmel West?
It was one of the only ICUs in, at least that I had seen in the state that hired on new grads. And it was a unit that took all kinds of different patients, whether they're surgical, medical, or cardiac patients.
Did you have a training period when you started?
Yes, it was about 15 weeks.
And can you tell us a little bit about that?
So, they called it the married state preceptorship. So essentially you have a preceptor who is with you directly during this 15 weeks. It can be different preceptors. However, as it progresses, they become less involved in the direct care of the patients.
Did you have any opportunity to observe any palliative extubations during your preceptorship?
Yes, I know for a fact there was one.
And who was that with?
I don't remember who my preceptor was. However, I do know that it was Jake Deemer whose patient it was.
Was Jake your preceptor?
No, he was not.
Right. And who was the doctor on that?
I believe it was Dr. Husel.
And if Jake wasn't your preceptor, how did you come to be observing that?
Well, I mean, we were all pretty tight-knit on the unit, and so his patient was having a palliative withdrawal done on them, and he wanted to be a teacher, or not a teacher. He was trying to help educate me, since I was on orientation, of kind of how palliative withdrawals went on our unit.
So during this first palliative extubation with Jake Deemer and Dr. Husel, do you recall what dose of fentanyl was used?
Yes,
And what was that?
it was 1,000 micrograms.
During your preceptorship, did you have a chance to observe palliative extubations with any other doctors?
Yes, there were a few.
Do you recall which doctors?
I believe Dr. Ralston was one of them. Dr. Hagris, I believe. I can't remember any more off the top of my head.
Are you familiar with the term morphine equivalency as it's used when comparing like fentanyl to morphine and other opioids?
Yes.
Were you aware of that at that time?
Not at the time. I became aware of that after.
So were you able to compare the doses that Dr. Ralston and Dr. Hagris and Dr. Husel was giving?
Finish your question.
That was the end of my question.
Let's rephrase.
Did you have the knowledge to accurately compare the strength of the doses that were given when you were observing palliative extubations with different doctors?
Objection.
Okay, let's go sidebar. I'm just waiting for her to get caught up here. The objection sustained, disregard the question. Next question.
You've testified you weren't familiar with morphine equivalency, but did you know how to compare different opioids to each other?
Objection. Well, I withdraw that.
Not at the time, no.
After you finished your preceptorship, what shift did you start working at Mount Carmel?
I was primarily night shift.
All right, and what doctors did you work with?
Usually Dr. Husel or Dr. Hagris.
At some point, did you have any conversations with Dr. Husel regarding his fentanyl doses? Without telling me what he said.
Yes.
Was there an occasion where, or did he ever show you any documentation to support his dosing?
The only documentation that I can recall is the IV Lexicomp, which was our intranet encyclopedia for medications.
And what did you learn from Lexicomp?
You know, my knowledge then was that you could dose it 1 microgram per kilogram to 150 micrograms per kilogram for a patient.
And was that Lexicomp guideline, was that specific to palliative extubations?
No,
Did it talk about palliative extubations at all?
no.
Did Dr. Husel give you any guidance on what might be appropriate for a palliative extubation versus perhaps a surgical procedure?
I don't think he necessarily put a range on it.
Do you recall Dr. Husel ever showing you any articles? Like
Could you
other
be more
articles-
specific?
Other articles about his fentanyl and his dosing? Or,
Not to my knowledge.
okay. At this time, were you aware of the side effects of fentanyl?
Roughly, yes.
And what side effects were you aware of then?
I knew that it could cause a drop in blood pressure, respiratory depression, you know, constipation if long-term, and other things that opioids do.
Were you aware of the side effects of benzodiazepines?
I don't recall.
Did Dr. Husel ever educate you on the side effects of benzodiazepines?
I don't believe so.
Are you familiar, or at the time back then, were you familiar with the term synergistic effect?
I had heard the term before, but I had never really comprehended its true meaning, I guess, in regards to fentanyl and midazolam.
Did Dr. Husel ever attempt to educate you on that?
Not that I can recall.
Were you aware of whether Mount Carmel had any guidelines with regard to palliative withdrawals?
Now or?
Then, sorry.
Okay, then. Yes, I was aware that they had the guidelines. However, I don't recall where I could find them or anything like that.
Were you, back then, were you aware of whether they had guidelines about, like, IV guidelines?
I knew they had IV guidelines back then, yes.
Had you reviewed any of those guidelines?
It was briefly an orientation, and they said that we could find them on the intranet, but never after that, no.
When Dr. Husel was explaining his dosing to you, did he ever show you any of the hospital's guidelines?
Objection, asked and answered.
No, that's a new question.
I don't recall.
Did you ever have any occasions to be present for end-of-life talks with Dr. Husel where he talked about brain death?
I believe one time, yes.
And can you tell us about that?
So I believe the term is anoxic brain injury, you know, and it usually happens with cardiac arrest patients where their heart stops pumping blood to their brain, and that lack of oxygen causes irreversible brain damage. The term brain death, I feel like that can be it's a total brain death or partial loss, depending on what's happening. I believe you need a brain scan in order to tell for sure what areas were damaged and which weren't.
To your knowledge, had a brain scan been done before this talk?
I don't believe so.
During your time at Mount Carmel, did you have any, if a patient was stable but terminal after a palliative extubation, were they able to be transferred off of the unit?
I'm sorry, could you repeat the
Sorry, yeah.
question?
If a patient was stable but in a terminal condition after a palliative extubation, were they able to be transferred off of the unit?
I think it depends on the patient, but yes.
Did you ever have any occasions where a patient just stayed in the unit after their palliative extubation?
Yes, that was frequent.
And what type of, in your role as a nurse, what type of things would you do for the patient and the family that you can recall?
Yeah, so we would do anything from, just making the patient more comfortable with medications to just other measures such as pillows, extra blankets, and you would also care for the family as well. And so a lot of times we would get a cart. It had coffee on it and little snacks and stuff just to make them, more comfortable as well. A lot of times you would get the hospice cart on the hospice floor, and it had little crafts and things you could do just so they could remember their loved one.
Do you remember any of those crafts specifically?
Yes, there was one that patients' families really enjoyed using. It was like a family tree, and they would have ink that you could put your thumbprints. I know we would put the patient's thumbprint in the middle, and then his family member or their family member would put their thumbprints all around on the tree. Just, a good last little activity, I guess, before passing.
Did you ever have any occasions where patients had like special requests at that point?
Yes, there was one that I had where the patient had decided to go ahead and withdraw care and pass, on hospice care. And he was still in the unit, and he wanted IHOP. And so we ordered IHOP and got him his waffles, and it was good. So.
I want to take you to November of 2018, specifically November 18th of 2018. Were you working that night?
I believe so, yes.
And do you recall who your patient was that evening?
I do.
And who was that?
I believe it was Rebecca Walls.
Great. What time did your shift begin that evening?
I believe it was 7 p.m.
Great. And when you started a shift, how did you get information about your patient and get up to speed on their condition?
Yeah, so I believe the patient was in our CV ICU, so it's a separate little 6-bed unit in the Mount Carmel ICU. And we got information via handoff, which is report, is what nurses call it. And so I went to the bedside, and we did bedside report with the nurse who was working previously.
From that bedside report, what did you come to learn about Ms. Wall's condition?
I got a little bit of her background information of why she was on the unit and what kind of happened to her to make her wind up on our unit. And essentially I was told that her condition was worsening pretty rapidly throughout the day prior to me taking shift.
Had Ms. Wells been your patient at any point prior during her hospital stay?
No.
When you started your shift, do you recall what Ms. Walls' code status was?
I believe it was a full code.
And what does that mean?
It means that if for some reason her heart were to stop or she were to stop breathing, we would have to perform CPR and life-saving measures.
At some point in the evening, did her code status change?
Yes, it did.
What did it change to?
I believe we changed it to a DNR CC.
And what does that mean?
So that is the order that we place to withdraw care. It's for hospice patients. It's a do not resuscitate order with comfort care.
Can you walk us through what happened from when you started up until the point that you were having that conversation with the family?
Yeah, I can do that for you. So as I'm getting handoff, I was told that her labs are not looking well. She was on high-dose pressors and vasopressors, excuse me, and along with fentanyl drip. She was also on CRRT, which is Prisma. It's dialysis for hemodynamically unstable patients. And so everything was going all right, and eventually, throughout the first part of my shift, the first couple hours, I noticed that her blood pressure was decreasing pretty quickly. I believe she was in the 80s systolically for a little bit, and I decided to titrate up on her pressors, her vasopressors, and I noticed that she kept continuing to drop her blood pressure, and I believe when the Levofed got to 42 mics per minute is when I decided to call Dr. Husel to let him know, because when you have to increase your vasopressors that much and that often, I believe that it's evident of a patient who is getting ready to go into cardiac arrest at some point in the night. And so I called Dr. Husel to see what his suggestion was and what our plan of care should be, if we needed to change anything or just keep going up on the Levofed. And he said to go ahead and hold the Levofed. It's maxed out. It's not going to do much more based upon her labs. So we're going to max out the Levofed here and go ahead and call the family and tell them to come in. And I don't believe she had any family.
Yeah, let me jump in here for a
Sorry.
second. Showing you what's marked as States Exhibit 13E. Are these your notes from that evening?
Yes, they are.
And does this note right here reflect what you were just talking about? Or the family?
Yes, correct.
And do you remember who Janet was?
She was the patient's church friend from church. She was the POA, the medical power of attorney.
Okay. And was she at the hospital at this point, or did you have to call her?
No, I had to call her in.
All right. After Janet arrived, were you present for a conversation with her regarding the code status?
I was, yes.
Without telling me what anyone said specifically during that, did Janet ultimately make the decision?
Yes, she did.
All right. And was there a chaplain there, if you remember?
Yes.
Right. And from the same exhibit, is this your nursing note on that point?
That's correct, yes.
All right. I just want to go through some of Ms. Wall's medical records with you from leading up until that point. Right. Do you see your name on this first section right here?
Yes, I do.
All right. And in this pain score section, what are you documenting?
Pain score of 0.
And do you recall what scale you were using at that time?
I believe it was the CPOT scale.
Right. So, and then this 8, that was not your score, is that correct?
I did not record that, no.
Okay. Going to the next page of the same exhibit. This is pain level acceptable column. Are you documenting in this as well?
Yes, I am.
And how often were you checking on Ms. Walls to document this?
It looks about every 2 hours.
Turning your attention to this eye-opening response, what are you documenting there?
For 1957, she was opening her eyes to pain. The same with 22, 23.
How would you test for pain when doing these tests?
Just you would pinch the fingernail.
So if you pinched her fingernail, she was opening her eyes at this point?
I believe so, based
Okay.
upon the charting, yes.
Okay. And then looking at the motor response at those same points, what does the flexion withdrawal mean?
I believe it means that when they feel a painful stimuli, they withdraw and retract the extremity.
And just at the bottom of this page, the verbal response. What are you testing there and what are you documenting?
That the patient was generally unresponsive.
To verbal stimulus?
I believe so,
Okay.
yes.
Looking at the top of the next page, what are you documenting here?
Glasgow coma score.
And what do the scores that you documented mean at that time?
So 7, 7, and 6, those were, I believe, to the best of my recollection, I believe that means that she was like solemn, not very arousable, I guess.
Right. On the next page of the same exhibit, in respiratory findings, what are you documenting at this point with regard to Ms. Walls?
Breathing without difficulty.
And what tests would you do to make these observations?
You would listen to the patient's breath sounds as well as observe the ventilator synchrosy. Yeah.
Okay. On the next page of the same exhibit, the sedation level column, do you see that you have documented there?
Yes.
And where it says see below, are these your responses for that see below?
I believe so, yes.
And what are you documenting here on that scale?
Just response to verbal and physical stimuli,
Right.
and that she was 4 on that.
Do you recall what a 4 means?
It's minimal to no response.
On the next page, the level of consciousness, what are you documenting at this point?
That the patient was obtunded.
And what did that mean to you when you were documenting that?
It meant to me that she was very, it's minimal responsiveness as well.
For this behavior mood, what does it mean when you're documenting calm on these records?
I believe that it means just the patient isn't agitated. They're laying in bed, calm, like it says. So.
All right. Again, response to stimulus. Did you mark 3 different things where it says see below?
Yes, I did.
Turning to the next page. Are those your responses?
Yes.
And can you explain what is a sternal rub?
A sternal rub is, it's similar to just rubbing your fist in the patient's sternum.
And why would you do that?
Just to try to awaken the patient and get a response that way.
And what is a nail bed pressure?
It's just like a pinch on the nail bed.
All right. And when you say that opens eyes, withdraws grimaces, what does that mean?
It means that when you apply the sternal rub or the nail bed pressure, the patient would open their eyes and would withdraw or retract limbs or just even clench their fists. It can mean a lot of different things. It's very subjective.
So based on your notes and what you observed that evening, how would you describe Ms. Walls' pain level that evening? Or was she in pain when she's just laying in bed without those tests being done?
When the patient was on the ventilator and all hooked up to everything, I believe her pain level was controlled at that time.
All right. Now, after this conversation to change the code status, did you receive an order for medication?
Yes,
Who did you receive that order from?
Dr. Husel.
And do you recall what that order was?
Yes, it was 1,000 micrograms of fentanyl and 10 milligrams of Versed.
Did you verify that order with Dr. Husel?
I did, yes.
And how would you verify an order with him?
Well, we were trained to always, repeat our verbal orders back to our physicians just to make sure there were no errors. And so I just verbally confirmed that with him in our huddle outside of the room.
And that was the correct dose for Ms. Walls?
Yes, it was.
What did you do next?
I don't know exactly what I did next. I know that I placed in the verbal order, wrote it in to the charting system. And so Ms. Walls was my only patient that night. And so I believe I wanted to prepare the room for the palliative withdrawal. And so I went to the Pyxis and withdrew the medications from the Pyxis.
Okay. And showing you what is marked as States Exhibit 24M. This is a Pyxis report. Who is the patient on this?
Rebecca Walls.
All right. And is this your name in this column?
Yes, it is.
And does this correspond with the medicine that Dr. Husel ordered? These last two columns, or rows?
Yes, that's correct.
All right. And do you recall if you took this medicine out via override, or did you wait for pharmacy approval?
I overrode the medication.
Why did you do that?
Because it's faster and it was for, I believe, an emergent situation at the time.
At some point, did you become aware that pharmacy had rejected the order?
After the fact, yes.
Now, after you withdrew the medication from the Pyxis, what happened next?
So after I withdrew the medication from the Pyxis, I received word from Andrea Schaefer, our charge nurse at the time, that a patient was emergently seizing up on the floor, one of the floors, and that I was going to have to take that patient to MRI from the floor emergently, so right now. And so after that notification from Ms. Schaefer, I asked Nurse Wes Black, if he would be able to help me perform the palliative extubation, since I would not be back for 2 to 3 hours after that.
So were you present when this medication was administered?
No, I was not.
Were you present at the time of death?
No, I was not.
So did you have any further treatment of Ms. Walls that evening?
Yes, morgue care and cleaning her up and just making her, look presentable. And I believe I said, goodbye to the family or her friends, her church friends who were there, and just consoled them a little bit before they went home because it was pretty late at that point.
Okay. Showing you the medication administration record for Ms. Walls, which is part of State's Exhibit 13E. Do these two entries correspond with the order that you were given and entered?
Yes.
And does that reflect that it was Wesley Black that administered the medication?
Yes, it does.
Mr. Blair, do you still work at Mount Carmel?
No, I don't.
When did you leave Mount Carmel?
I left Mount Carmel in February of 2019.
And how are you currently employed?
I am not employed as a nurse. I haven't been able to. I was terminated from my last position as a nurse at Mercy West Hospital in Cincinnati. when this was released to the media. And I am currently working for Mulaney's Pharmacy in Cincinnati, delivering medications in my spare time. It's a part-time job. And I'm currently going to Powerline Mechanic School at the Warren County Career Center.
And what is the power line mechanic school? What are you studying to be?
Objection, relevant.
I'll give a little on this.
It's a lineman, so they climb the power line poles and build new electrical transmission lines, distribution lines, and things like that, so.
No further questions.
Mr. Baez?
Please report. Good afternoon, Mr. Blair.
Good afternoon.
In the 2 years that you worked at the ICU, how many times did you see doctors walking around saying, hey, look at this article, hey, check out this article for my doses?
Only one doctor did that.
And
to my
what doctor was that?
Dr. Husel.
Okay. And would that be because Dr. Husel was known for educating other members of the ICU team?
I believe he was, yes.
Okay. And that was to help provide better care for patients?
Yes.
Now, the IHOP, or the waffles,
Yeah.
you go to the Waffle House, right?
No, sir.
Now, that was Dr. Husel's patient, right?
I'm not entirely sure.
Okay. You never saw anybody bring a swimming pool into the ICU and give anybody a baptism?
Objection.
I'll permit it.
No.
Now, sorry, I can't tell you why I asked you that question, but I'll move to the next.
Counsel, let's move on with the
Now-
question, please.
Now, as it relates to Ms. Wall's care, I want to ask you a little bit about that.
Absolutely.
When you first, throughout the course of the evening, at the beginning of the evening, she started to go downhill pretty quickly, correct?
That's correct, yes.
In fact, as it relates to the vasopressors, we've heard vasopressors compared as jet fuel. Would you agree with that?
In a way, yes, yes.
Like adrenaline to help the blood pressure?
That's correct.
And it started out at 16, correct?
To the best of my knowledge, yes.
That was in milligrams, right?
I believe I think it's micrograms per minute.
Okay, sorry. So 16 micrograms per minute, and then it more than doubled by the end of the evening, correct?
I believe it ended at 42.
Okay. So, and 42 is considered the maximum that you can give, right?
Not necessarily.
Okay. Would you say that she had maxed out on this presser though?
Based upon her lab results, I believe so.
Okay. And so basically what you do is as her condition starts to go down, sometimes you feel you need to adjust the doses higher, correct?
That's correct.
And she just kept going down even after you kept raising it, correct?
That's correct.
And you kept raising it to the point where you felt you couldn't raise it anymore, right?
Yes.
Because you thought the next thing that would happen would be her heart would stop.
I believe she was going to code that night, yes.
Okay. And when someone's heart stops, they die.
Correct.
Now, it's at this point that you brought Dr. Husel into the picture and you explained to him what was going on with your patient.
Yes.
And then he advised you to get the family together?
Yes, he said to call the family in.
And it's at this time that, shortly after that, the family arrived?
I believe it was about 2 hours later, or maybe an hour later. I'm not entirely sure.
Okay. There was nothing done within that hour to rush this thing along, was it?
I don't believe so.
In fact, you patiently waited for the patient's family to arrive.
That's correct.
And once they arrived, there was a discussion with you, Dr. Husel, and the family, or her friends.
And the chaplain, yes, sir.
Okay, so all of you were there. How would you describe Dr. Husel's demeanor when he spoke to this family?
You know, I think Dr. Husel was a very caring doctor. I think he was very informative and just a genuine guy when he was talking to the family members or the power of attorney and friends about how sick their loved one truly was. I believe that he cared for his patients deeply.
Okay, and was he informed? You said he was informative.
That's correct.
Did you feel satisfied that he gave the families all the information they needed to be able to make a decision of what to do with Ms. Wallace?
Yes, I believe that.
And if he had not, would you have spoken up?
Could you clarify the question,
Sure.
please?
If he wasn't informative enough, would you have assisted and contributed to the conversation?
Absolutely.
Okay. And did you feel the need to do that with Ms. Wallace?
Not at that time, no.
Okay. And then all of these records that you were shown by the state, there was a document you were shown where you showed that she was grimacing, correct?
That's correct.
And that told you that she could feel pain.
Yes.
And you're aware through your training and experience that dying is a painful process?
Yeah.
And I noticed you qualified your answer as it related to the pain scores by saying because of the life support measures, her pain was being taken care of, correct?
I believe that it was controlled at that time while she was on life support, yes.
And one of the things that you had mentioned when speaking to the families or to her friends was that the Levofed was really helping keep her alive, correct?
Yes, the Levofed was keeping her blood pressure.
And that's, again, the vasopressor, right?
That's correct.
And could you tell the ladies and gentlemen of the jury how fast, once you turn off a vasopressor, it stops working?
From my experience, it's
Sustained.
From your training and experience, can you tell us, based on your training and experience, can you tell us how long it takes for a vasopressor to stop working?
Objection.
I'll permit that one if it's within the subjective.
from my experience, I've seen it from about 30 seconds to a minute, even to maybe a minute and a half, depending on the patient.
Okay. And now, as it relates to the order, when Dr. Husel gave you the order of 1,010 of Versed, 1,000 micrograms of fentanyl and 10 of Versed, you had known at that moment in time that Ms. Walls was obese, correct?
That's correct, yes.
And I believe she weighed somewhere in the neighborhood of 270 pounds. Is that correct? Sound about right?
I'm not entirely sure what her weight was.
But that number doesn't shock you, or
No.
based on your memory?
No.
And a BMI of 47.82. Does that sound familiar or about right?
It sounds about right for her weight, yes.
Okay. And that's something you take into consideration when analyzing the appropriateness of a dose, correct?
I believe so, yes.
You also take into account how much opioids they've had in their stay, correct?
That's correct.
Did you have a chance to see how much opioids she had been given during her stay?
Objection. Can we get a time frame for when he knew?
Okay, let's bring it to a time frame.
Sure.
You had the whole stay.
Sure. From November 13th through November 19th, 2018, are you aware of how much fentanyl she had or opioid equivalents she had?
Objection.
Are you aware? Overruled.
I was not at the time.
Okay. Did you have an opportunity to look at the records?
After the fact, yes.
Okay. And were you aware that she had 6,500
Sustained.
milligrams?
Time frame.
Yes.
He's already testified.
Were you aware at the time that you were treating Ms. Walls that she was not opioid naive?
That's correct.
And in fact, you were aware that she, at that time, that she had received a significant amount of opioids?
Objection.
Sustained.
Would you consider the amount of opioids that she had at the time that you were treating her significant?
Objection.
I'll permit the question.
I believe so, yes.
And when, after this order was given, you in fact went to the nurse's station to discuss the order with Dr. Husel, correct?
That's correct.
And the two of you were not alone, correct?
That's correct.
In fact, Nurse Wesley Black was there,
I believe so, yes.
and there was another nurse there, Olivia Bond.
Yes.
Okay, and it was at this time that you discussed the dose amount, correct?
Husel and I discussed it amongst ourselves with them in the huddle, I guess you
And
could say.
in this huddle, did anyone voice any concerns or complaints about the dose amount?
Not to my recollection.
And you, of course, if you had an issue with the dose amount, you would have mentioned it to Dr. Husel.
Absolutely.
You felt he was approachable enough as a doctor to question him?
Yeah, he was I viewed him kind of like a mentor. You know, I wanted to be a CRNA myself, so yeah, he was very approachable.
And you could have also brought it to another nurse's attention, correct?
That's correct.
Including your charge nurse,
Yes,
or one of these other two nurses who were present at the huddle?
that's correct.
As well. Now, this was not your first palliative extubation with Dr. Husel, was it? Well, let me rephrase that. This was not the first time you had done a. Sorry, it's late in the afternoon, Mr. Blair. This is not the first time that you had to institute comfort care with Dr. Husel, correct?
That's correct.
Okay. And in fact, just a couple months earlier, you had one with Dr. Husel?
Yes,
And that was with a Mr. McClung?
that's correct.
And during that comfort care, Dr. Husel ordered 4 of Dilaudid and 6 of Versed, correct?
That's not correct.
What did he order on that?
He ordered for the medication for that patient. The first order was for 4 milligrams of Dilaudid, and then I believe it was around 30 minutes later, I received another order for 6 milligrams of Dilaudid after the patient said they were still having pain.
And that there was no fentanyl given to the patient on that, for that comfort care?
There was no fentanyl given to that patient, no.
And so, in the course of your experience, you saw different doses for different patients, correct?
Yes, yes.
Now, as it relates to overrides, you mentioned you overrid the Pyxis on this case, on Ms. Wall's case. The fact is, overrides were quite common in the ICU, were they not?
Yes, sir, they were.
And that's because things move rather quickly in the ICU, right?
Yes.
And in fact, you need to override the Pyxis just to get sterile water, correct?
That's correct.
Now, when you gave Rebecca, well, when you took out the medications from the Pyxis, it was your full intention to administer that dose, correct?
Yes, it was.
And when you intended on administering that dose, your intent was to provide her with comfort care, was it not?
Absolutely, yes.
It was to alleviate Ms. Walls' pain, correct?
Yes,
And the potential pain of dying, correct?
correct.
It was not to harm her in any way, was it?
Absolutely not.
And it's been said repeatedly in this trial that you usually assume that your coworkers have good intentions. You agree with that, right?
I believe so, yes.
Absent any evidence of bad intentions, you should assume they have good intentions, right?
Correct.
Because people in the healthcare profession don't get into it to harm people, do they?
Objection.
Sustained.
You got into healthcare to help people, right?
That's correct,
Not
yes.
to harm people.
Not to harm anyone.
Thank you, sir.
Redirect.
Defense counsel asked you if Ms. Walls had been receiving a significant amount of opioids, in your opinion, and about her grimacing. Did you have any occasion during your treatment of her to give her any pain medication that night? Any, any IV boluses for breakthrough pain or anything?
No, I didn't. I did not administer any medication like that.
No further questions?
Okay, you may step down. Thank you. Let's call our next witness. We got about 15 minutes to break, or do you guys need a break now? Keep on going? You guys asleep on me? Okay.
Step over towards the door. Go on up. Stand by the chair, just remain standing. And need you to raise your right hand. You swear or affirm to tell the whole truth, and nothing but the truth, so help you God? I do. Thank you. Please be seated. A few seconds to make yourself comfortable. And if witness to state your name for the record and spell your name.
Kathleen McDowell, KATHLENMCDOWELL.
Okay. Can you give us a little bit more buy-in? They need to hear you. Okay? And you do have my permission to shout it out, okay?
Okay, you want me to respell it?
Yeah, why don't you respell it for them so they can get the spelling?
Kathleen McDowell, KATHLENMCDOWELL.
Is that better, guys? Okay. Mr. Zion?
Good afternoon, Ms. McDowell. Can you tell the ladies and gentlemen of the jury what you do for a living?
I'm a nurse.
All right. Can you tell them about where you went to college and where, may I approach with the
Yeah, you may.
for our witness? Can you tell us where you went to college and where you went to nursing school?
I went to nursing school at Mount Carmel.
All right. What year did you go to nursing school at Mount Carmel?
It was the accelerated program. I graduated in 2016.
All right. So the accelerated program, how long did that last?
13 months.
So you went from not being a nurse to being a nurse in 13 months.
Yes, sir.
And in 2016, you are a newly minted nurse?
Yes.
All right. Let's talk about your experience as you start the ICU, your training and experience in 2016. What type of things did they teach you in this 13 months
Yes.
at Mount Carmel Nursing School about drugs and their interactions, dosages, etc.?
I believe we had 2 pharmacology classes that we took.
And how extensive were they?
We would talk about general drug classes, what you would expect to see from the medications that were given.
All right. What about dosing? Did they teach you about dosing, or what, if anything, did you learn about when you might learn about dosing?
Dosing was something that they discussed would be taught on the unit.
Would be what?
Taught on the unit.
Okay. So 2016, Mount Carmel Nursing School, where did you get your first job at?
Mount Carmel ICU.
All right. Had you
At West.
prior experience in the Mount Carmel ICU before starting there?
No.
Tell them about your orientation, if you did a preceptorship, etc.
So in nursing school, we did a preceptorship. I think it was 6 or 8 weeks. It was a certain number of hours that we had to fit into the time. And then when I went into the unit, I spent half my time on day shift, half my time on night shift for the training.
How long
Where-
was,
I think it was like 12 weeks, I
Okay.
think.
and when, during that 12 weeks, did you shadow or were with another more experienced
Yes.
nurse to see what they did?
Yes,
All right. And then you started on your own in the ICU after that 12 weeks?
yes, on day shift,
On day shift?
yes.
How long did you work on day shift?
6 months,
All right.
roughly.
At some point, did you switch shifts?
Yes, I went to night shift.
Why did you switch to night shift?
Day shift was very fast-paced. I wasn't comfortable. I wanted to stay in ICU, but I wanted something where I could have more time to learn.
All right. So give us a time frame of when you started night shift at the ICU at Mount Carmel West.
Like fall 2016, somewhere around there.
What doctors do you remember working with you on the night shift at the ICU?
Dr. Husel, Dr. Hagris.
Right. And do you recall whether you worked with one doctor more or the other?
It would depend on what shifts I was on. Dr. Husel worked certain days of the week, and Dr. Hagris worked the other days of the week.
All right. I'm going to take you to September 25th of 2018. So at this point, how long have you been working as a nighttime ICU shift nurse?
About 2.5 years.
All right. Do you remember coming into contact with a woman named Corinna Blake?
Yes, sir.
Tell us about your contact with Corinna Blake and what happened with her.
Objection. Relevance?
I permit it.
I think we should sidebar, Judge.
Okay. David?
Thank you. Please be seated.
Hope you guys had a good break. Everybody get comfortable, you're still under oath. Okay, remember to keep your voice up. Okay. Mrs. Brown?
We were talking about Corinna Blake.
Yes,
September 25th, 2018. You've been a nurse for how long at this point?
2.5 years.
Have you ever worked anywhere outside of the ICU at Mount Carmel?
No,
And besides that first 6 months, have you ever worked any other shifts besides the night shift at Mount Carmel?
no,
And besides Dr. Hagris and Dr. Husel, have you ever worked with any other doctors outside the day shift ever in your career?
At the end, there was a nurse practitioner that worked on the night shift with Dr. Husel. I don't know if she was in her preceptorship, but that's the only other person I can think of.
Okay,
You guys hearing her okay? No?
all right.
Let's
I'm
throw
gonna-
it out there.
I'm going to step back just a little bit and raise my voice a little bit, okay? So tell us about what you remember of Corinna Blake. Look back in your mind's eye, September of 2018, you're walking onto the floor of the ICU. What's her condition? What do you do?
She had been declining. She was not doing well. She was maxed out on pressors, blood pressure medicine to keep your blood pressure up. Just not doing well. A resident had come in and did a palliative talk and changed her code status to DNR-CC.
Who did that?
Dr. Sagar Gandhi, a resident
All right.
from day shift.
Okay. Doctor, repeat the name and can you spell it for her?
Yeah, Dr. Sagar Gandhi, Sagargandhi.
Okay.
All right.
Did you get that, Sam? Yes. You guys get it? Okay.
So she's declining. Dr. Sagar Gandhi has talked to family about DNR-CC.
Yes.
What, if anything, do you remember about what brought her to the hospital and her condition when she arrived at the hospital?
I believe it was a week prior. She had come in. She had an ulceration on her belly, a hernia that was infected pretty bad. Also had like maggots and bugs and stuff in that, as well as lice in her hair. She was brought up to the ICU from the ER when she came in, and they intubated her, and she was on a lot of medicines.
Had you been caring for her previous to the date of extubation?
No.
All right. So this is all you found out that day when she was extubated?
Mhm.
All right. What, if anything, did you know about, or you thought you knew about, her prior drug use?
She had addiction. She had alcohol addiction.
All right. At the time in 2018, did you think she had some other type of addiction?
I thought it might have been drug addiction.
All right. So, a decision is made for DNR-CC. How many patients do you have that night besides Miss Blake?
I was supposed to have Miss Blake and then another patient, but because of Miss Blake's condition, I asked to be singled with that patient.
Why did you ask that?
Because when I came on shift, she was still a full code. So at some point in the night, I expected her to code, and I didn't want to have to worry about taking care of the other patient while I was taking care of her.
Okay. So when the decision is made to extubate, what happens next? Is Dr. Sagar Gandhi still there, or is there another doctor now in charge of her care?
He left. He was on day shift, so he left. Dr. Husel was on for that night. So once the doctor has the talk with the family to change code status, then typically medications are put in, orders are put in for medications to keep the patient comfortable when the tube is taken out.
Okay. How much experience at this point in 2018 had you had with palliative extubations?
Some experience.
What about training? What did they teach you about palliative extubations in that 13-month course you took to become a nurse?
Very little.
What about training at Mount Carmel?
There was a palliative care class that we went through in orientation, but it really did not apply to what we needed to know in the ICU. It was more geared towards 3 Tower, who had palliative and hospice patients.
Okay. So where did you learn about how to do palliative extubations?
in the moment with preceptors and with the other nurses around me.
Did the doctors also teach you about palliative extubations?
I don't think I ever was taught by the doctors for palliative extubation.
So you're learning from those around you at the nighttime in the ICU?
Yes,
All right. So is there family there at bedside when it's time to palliatively extubate her?
yes.
Do you recall if the family stayed inside or not, the room?
When the tube was taken out, family stepped outside the curtain,
Okay.
and I called them back in as soon as the tube was out.
You said that medication orders are put in, and then you go get the medication.
Correct.
Did that happen in this case?
In this case, the orders were put in. I believe I looked at them and I had questions, so I called Dr. Husel on the phone.
All right. Were the medication orders given to you, or were they in the computer?
I believe they were in the computer.
All right. So you called Dr. Husel. Do you recall what those medication orders were?
500 micrograms of fentanyl and 6 milligrams of Versed.
All right. Why did you call Dr. Husel?
It seemed like a high dose.
All right.
But
What, if anything, did Dr. Husel say when you questioned this high, what seemed to be to you a high dose?
he said it was okay and to give it.
Did you question him further?
I did not.
Did you ask for any other explanations?
I did not.
Why not?
I trusted his judgment. I had also called the pharmacy and my charge nurse. My charge nurse was busy with something else at the time, but I also called pharmacy and asked them about it. And I didn't have anything solid to back up my concerns with the medication dose.
All right. Regarding pharmacy, do you recall whether or not you told them what the procedure was for?
I'm not sure.
Okay. What do you mean you didn't have anything to back up your concerns? Tell the folks what that means.
I thought the dose was high, but because of what the pharmacy told me, I didn't have anything that told me, yes, this is not right, this shouldn't be done.
What can happen, okay, so what happens if you say, do you have the right not to follow a doctor's order regarding medication?
Yes.
All right. What would you do if you decided not to give that medication?
I
What would be the
would tell the-
procedure? Who would you go to next, et cetera?
I would tell the doctor, then I'd go to my charge nurse if I had an issue with the medication, and then up the chain of command.
Is the charge nurse technically in your chain of command?
I don't think so, but that was always where I would start,
And why would you start with the charge nurse?
because the charge nurse has the most experience on the unit,
All right. Who is the next person in your chain of command?
the nursing supervisor.
And is there a nursing supervisor working at night in the ICU?
They're working over the hospital, so they're somewhere in the hospital.
All right. And so that's your chain of command, correct?
Yes.
What happens if you're wrong?
You get written up for insubordination.
And who would write you up for insubordination?
I believe the doctor would.
Did you give this medicine?
Yes,
And you said it was because you trusted Dr. Husel.
yes.
Let's talk about why you trusted Dr. Husel. Describe what you observed with Dr. Husel during your 2.5 years in the nighttime ICU.
He was always around when you needed him. If I were to call him and say, hey, I have concerns about this patient, I need you here right now, he would come right around the corner and come look at them. I would talk about my concerns with him. He also did a lot of teaching on the unit for the nurses, whether that be like vent talks or talking about pathophysiology, why are these things happening to your patient. So he would sit and educate us.
Okay. Did you know about his training?
He went to Cleveland Clinic.
Is that considered a good school?
Yes,
Is that another reason you trusted him?
yes,
Went to a good school and was very engaging and a teaching doctor.
yes.
All right. So when he said it was okay in your mind.
I trusted his judgment.
So what'd you do next? How'd you get the medication out?
I pulled it from the Pyxis. I used the override function. I don't know why.
Well, why do you say you don't know why you use the override? We've heard that override is used all the time. In your mind, when is it?
Objection leading.
Finish the question, please.
In your mind, when is it appropriate to use the override function on the Pyxis machine?
If there's an emergency
Overruled.
situation or.
Okay, hold on. Overruled, I permit the question.
Judge, counsel changed it the second time, but the first time he said, we've heard that overrides were done all the time in his question.
So you withdrew the first question, implement the second one?
It was a transition, Judge, into explanation of.
I'll permit the question, no good objection. Can you answer it?
Yeah, so you can override medication from the Pyxis if there's an emergency situation. So if someone is a danger to themselves or others, or they're going to try to pull their breathing tube out, which is very painful, there's a balloon on the end of the tube, and when you pull that out, they can cause damage. So those would be reasons to use the override. We also use the override for things like sterile water. If you dropped a medication or if you spilled it, you would use override for that as well.
In your mind, is this palliative extubation of Corinna Blake an emergency situation?
No, it was not.
So what, if anything, can you offer as to why you pulled these medications out on override?
I don't know. I don't know what I was thinking at that point.
All right. So you pull them out. Do they come out in 500 microgram unit doses?
I believe they come out in 100 microgram doses.
So how many bottles did you have to pull out for Corinna Blake?
5 for fentanyl, 3 for Versed.
All right. So, because it was 6, what were the unit doses for Versed?
The Versed comes in 2 milligram vials, so 2, 4, 6, 3.
All right. And what were the instructions per Dr. Husel on how this was to be given to Corinna Blake?
I don't understand the question.
What are the 5 rights? Well, let me read. I'll back up here. What are the 5 rights of medication?
Right patient, right medication, right dose, right route, and right time.
What route did Dr. Husel instruct you to give to Corinna Blake?
It was intravenous, so IV, into her IV access,
Was this an IV push or an IV bag?
a push.
All right. The route was an IV push. How is that delivered? And how quickly or how slowly is that delivered?
It's supposed to be administered over 2 minutes.
All right. So after pulling out the tube, the family steps out. Do you thereafter give her that dose into her?
The medication's given first. The IV drips that are run are all turned off. The tube comes out, and then the family comes in.
All right. What happened next?
About an hour later, I believe, the patient passed away.
All right. You say that you didn't recall receiving much, if any, training in nursing school about palliative extubations. You do recall a course that was given to you, or a talk that was given to you at Mount Carmel. Did you ever talk to Dr. Husel about his practices in palliative extubations?
In what regards?
In regards to how he would talk to a family?
So he had a palliative talk that changed at some point in 2018. The talk before was when he would sit down with the family, the patient's,
Objection, non-responsive.
I disagree, overruled.
the patient isn't doing well. These are your choices on what we can do. We can continue care or we can take the tube out. The talk changed at some point.
I'm going to stop you there. How did you know that the talk had changed at some point?
I had heard about it on the unit.
Okay. So, did you ask him how the talk had changed?
Yes.
What did Dr. Husel say regarding how had the talk changed?
He said the talk is more, they had a good run, the patient did a good job, but they're just not getting better. So we can either continue what we're doing or we can take the tube out and let them die with dignity, something along those lines.
How is this different, in your understanding, than how he had talked to families before?
It's more of a pointed conversation. It's a little bit more aggressive than the old talk.
What, if anything, did you ask him regarding?
Objection to the opinion.
I'll permit it.
What, if anything, did you ask him regarding how the success rate was with the change in the talk?
I had asked him how many people were choosing to go palliative over continuing care, and he said, I'm somewhere for 24 for 24 or 24 for 27, something along those lines.
It was one of those two, or did he give you both of those options?
It was somewhere around there. I don't remember if it was 24 for 24 or 24 for 27, but a very high rate.
Let's talk about Dr. Husel and your observation regarding numbers for him. Did you notice anything about numbers for him?
He seemed to like even numbers.
How did you make that observation?
Okay, hold on. I couldn't quite understand what she said.
I said he liked even numbers.
You liked even numbers.
I would
Okay.
to strike that, Judge.
Overruled.
All
Let's
right.
do something with this.
Yeah. So, did you notice something about the way he would dose medicine, knowing your observation of his even numbers?
So it'd be like 2, 4, or 6 milligrams. It wasn't typically like 1 milligram or 3 milligrams or 5 milligrams. It would be typically even numbers.
Did you ever see him do anything with numbers on the microwave?
Yeah, I remember sitting in the break room. And
Objection. Relevance.
How's this relevant?
Do you want me to do a speaking explanation?
No, but we probably should go sidebar since we've gotten into it. Ladies and gentlemen, see you in a minute. Relax.
You're never gonna hear something like this.
Ladies and gentlemen, oh, I'm sorry. Just put my glasses on to make sure you're okay. Okay. You're to disregard the last question and answer. Next question, please.
All right, so did you like Dr. Husel?
I did,
Did you trust Dr. Husel?
yes.
All right. You say he was a person that would always be willing to teach, sit down, actually sit people down and teach them?
Yes.
Did you ever see Dr. Husel do anything to pit people against each other?
I,
Objection. Relevance.
Okay, I understand. I knew that would there. I'm gonna permit it, but let's tie it up real quick.
What would you see?
so I remember being told by Anne, who was the charge nurse at the time, that,
Objection, hearsay.
Sustained.
When you were the charge nurse, what did you know?
pardon?
She went objection, she was never a charge nurse.
Okay, I don't think that's what his intent was to ask him the question. Let's rephrase the question, please.
Were you ever a charge nurse?
No,
All right. Did you ever do things to do scheduling?
yes,
All right. Did you ever become aware through your scheduling as a duty in the ICU and become aware of something Dr. Husel had done to pit people against each other?
Objection.
Overruled.
Calls for speculation.
It's her observations overruled.
What were your observations regarding that?
he put the boys against each other. I don't have exact examples.
The boys against each other?
Some of the nurses.
Objection. Move to strike. She said she doesn't have examples.
Overruled.
Tell us about the culture in the ICU at night, the boys. What do you mean by that?
There are certain nurses that Dr. Husel would hang out with and sit with and, chat with.
Do you remember the names of the nurses that he would sit and chat with?
Tyler Redman, Derek Dreyer, Jake Deemer.
And how would you describe the relationship you observed between those you call them boys, those men and Dr. Husel?
Like a bromance.
That was, in your mind, what that was going on there, a bromance? Is that a yes?
Yes.
Judge, we're going to object again. Relevance.
Okay. Overruled. We can go on the record on the break and I'll explain the ruling.
Sure.
Did you ever hear Dr. Husel talk about his relationship with pharmacists?
I remember hearing him say once, the pharmacist will call me and tell
Objection.
me that,
Hold on, there's an objection.
Okay.
Non-responsive to the question.
Overruled.
Go ahead.
I heard Dr. Husel say once, pharmacists tell me I can't give this drug or I can't give that
Objection,
much. And I,
hearsay.
Admission by a party opponent, Your Honor.
Overruled.
Go ahead.
sorry. The pharmacist would tell him not to use a certain drug or don't use this much, and then he would tell them okay, but then would just say like, I'll do what I want to do, give what I want to give.
Okay. They're requesting you get a little louder again. Sometimes we get
Sorry.
concentrating and we lower our voice, so, okay? Did you hear the last answer? Okay.
Did they hear?
Sound, yes.
Okay.
He indicated he did.
All right,
I didn't see anybody else shake their head no.
all right.
I got half and half in the top? Okay.
Did you ever see Dr. Husel administer ketamine?
Yes.
What was your experience with ketamine prior to seeing Dr. Husel order?
Objection.
Okay. This one, sidebar. Objection's overruled. Would you reiterate your question again?
Okay.
Once she gets typing?
Judge, I apologize. It was brought to my attention that the replies of the last couple of questions, and I don't know what those were not necessarily heard or understood by others. And they asked.
Any objection to the court reporter reading back the last, let's say, 3 questions and answers?
No objections, Judge.
Mr. Zion?
I have no objection, Your Honor.
Okay. What this means is she has to bring her computer up, so this may take a second. Yeah, the last 2 questions and answers, and then the last question beyond that.
Question, did you ever see Dr. Husel administer ketamine? Answer, yes. Question, what was your experience with ketamine prior to seeing Dr. Husel?
Okay, so you want a question beyond that? Okay.
Before, like 2 before that, we heard that.
You want the name of the nurses, right?
Yeah. It's okay, I'll be fine.
No, I didn't get propounded a question from you guys, I have to address it.
Okay.
Judge, we have no objection to Mr. Zion asking the witness again what the name of the charge nurse was, which I think is the issue.
Is that the thing you're missing?
Oh.
No? Okay. Okay,
Okay.
we'll get there. She has to translate her own script.
I think I can just add, if it's okay, I just ask that question again and see which, and she
Well,
speaks
there were a
aloud.
couple questions he's referring to that he didn't hear.
Okay.
Question, excuse me. Did you ever hear Dr. Husel talk about his relationship with pharmacists? Answer, I remember hearing him say once the pharmacist would call and tell me, correction, objection. The objection was overruled. Question, go ahead. Answer, I heard Dr. Husel say once, pharmacists tell me I can't give this drug or I can't give that drug. Objection, hearsay. The objection was overruled.
Your Honor, if I may, I think it was the question about the culture and the relationships within the ICU. I just don't want, I know it's not my witness and I could be admonished, but
Okay. Can you re-ask that question?
Yes.
Hold on, let her get caught up to us. She had to go back in time. Okay, Mr. Zion.
I was, just for transition, taking you back to where we were talking about the culture in the ICU at night. Did you ever see him hang out, you said you referred to them as the boys. Did you ever see him hang out with any male nurses?
Yes.
And what were the names of those male nurses that come to mind regarding the people you would see him often hang out with?
Tyler Redman, Derek Dreyer, Jake Deemer,
Did you ever see him hang out with a PCA also?
Andrew Henry. Yes.
I'm sorry.
Okay, now that's where your voice goes down. You get concentrating on his question and it just goes down. Knock him down with it, okay? Why don't you repeat those 4 names again, slowly?
Tyler Redman, Jake Deemer, Derek Dreyer, Andrew Henry.
Did you say Joe Henry?
Andrew.
Are we all caught up? Okay. Mr. Zion, back where we were.
Thank you. Ketamine. What experience did you have with ketamine prior to seeing Dr. Husel use it?
None,
Do you know what type of drug ketamine is?
not anymore.
Okay. Are you still a clinical nurse?
I'm administrative, I don't pass medications.
Okay. Looking back on ketamine, do you remember the appropriate doses for ketamine?
No,
Do you recall if you thought, looking back on ketamine, Dr. Husel used large doses of ketamine?
there was this one patient I remember, she was a psych patient, had,
Slow down and speak up, because I know what you're saying, and I'm having trouble. There's this one patient, she was in what patient?
she was a psychiatric patient, she had tried to commit suicide.
Okay,
So when someone tries to commit suicide, when they come into the unit, they can't have any jewelry, they can't have a call light, they can't have any silverware, anything that they could use to hurt themselves. So I had to get this patient to get her jewelry out, and she refused to take it out. We ended up calling security. They set these 4 really big men up to try to talk her out of it, and she still wouldn't take the jewelry out. So Dr. Husel ordered 400 milligrams of ketamine. He did not want me to give it until he was in the room, and he wanted 2 syringes.
Objection, non-responsive, narrative.
It is a narrative, but I'm gonna let her finish, go ahead.
He wanted 2 syringes pulled up, 100 milligrams in each syringe for 200 milligrams total.
okay. What happened next?
I went to give the patient the medication, and she asked me what it was.
Okay,
And I know that I can't lie to her. Dr. Husel was in the room since I was about to give it.
I'm going to stop you there. What do you mean you can't lie to her?
If I told her what it was, she might have refused to let me give it to her.
Why can't you just lie to her?
Can't lie. I'm not allowed.
By whom? I mean, like, you know, it's, like
As a
Mom says you
nurse.
can't lie. Does somebody else say you can't lie?
As a nurse, you cannot lie to your patient.
Is that one of your obligations, ethical obligations as a nurse?
Yes.
All right. And why didn't you want to just tell her what it was for and what it would do?
I was afraid she'd refuse it, not let me give it to her.
So what, if anything, did you see Dr. Husel do?
So Dr. Husel told her this medication was for something. I don't remember what he said, but it wasn't the exact use for the medication.
Did you consider that a lie to the patient?
Yes.
What, if anything, did you do when you saw Dr. Husel lie to the patient about the medication?
I didn't do anything. I gave the medication to her.
Did it work?
Yes.
And were you able to get the jewelry out?
Yes.
All right. Did she have a good outcome then?
Yes.
Why didn't you, you know you're not allowed to lie, were you aware of any ethical obligations of doctors to tell the truth? I'm asking if she was aware of any ethical obligations doctors had to tell the truth.
She's not a doctor, she's not
Okay,
qualified.
I would agree. Are you aware of any?
I
Okay.
wasn't sure.
You're not sure? Okay, move on.
Okay. So Corinna Blake was in September of 2018. In December of 2018, what, if anything, happened regarding people coming to talk to you about things that had happened in the nighttime ICU at Mount Carmel?
The senior leaders had walked the floor and told us that Dr. Husel was no longer working at Mount Carmel.
Okay. What happened next?
A couple of days later, me and the other nurses were put on administrative leave.
All right. At this point, in December, did you still like Dr. Husel?
I did.
Did you still trust Dr. Husel?
Yes.
Did you still at that time think he was a good doctor?
Yes.
What happened next?
He was fired. We were all put on leave.
Did you talk to the police?
Yes.
Did you talk to the police twice?
Yes.
Did you talk to the police and the prosecutors a third time?
Yes.
All right. Did you tell them all the things that you've told us today?
I didn't have the memory then that I do now about what happened. I didn't have the charts to look at. I was given a dosage and a date and say, did you give this? And I said, I don't know.
Once you were given the dose, once you were given the chart, was that able to refresh your memory regarding the care of Corinna Blake?
Yes,
And did you thereafter tell the police and the prosecutors the truth about your care for Corinna Blake?
I didn't see the charts until later, but as I thought about it more, I was able to come up and remember things to
All
help
right.
me figure out who she was.
All right. So at first you didn't know, but then as you thought about it, you were able to remember the details of it?
Yes,
And since then, have you had a chance to review this chart?
yes.
Okay. One moment, Your Honor. Thank you. I have no further questions.
Mr. Bias?
Please the court. Mr. Zion. Good afternoon, ladies and gentlemen. Good afternoon, ma'am.
Hello.
Now, I want to take you back to the beginning of when all of this started. And there was, I guess administrators had advised everybody that Dr. Husel was on leave, correct?
I believe so.
And on December, I guess the first week of December, you were first spoken to by HR and Risk Management, correct?
Yes,
Okay. And they had advised you that there was an issue with Dr. Husel and his dosing habits, correct?
they had asked about how we pull out medications, what medications we give with palliative extubations.
But you knew what was going on with Dr. Husel at that time, correct?
I knew bits and pieces, I didn't know everything.
Okay. And you were first approached by homicide detectives on the 8th of December, correct?
Yes,
And that occurred at 10:05 a.m. on December 8th, 2018, correct?
correct.
And that was, at that time, with a Detective Ann Pennington, a female detective,
Yes,
and a Detective Dana Kroom, correct?
yes, sir.
That gentleman sitting in the back, right there, right? Is that a yes?
Yes,
Okay. And they questioned you, first started about your experience there, how long you had worked there,
yes,
and subsequent to that, they got around to palliative withdrawals, correct?
yes,
And it's at this time that you had advised them that it had been a long time, in fact, you said you were honestly, it had been a long time since you did a palliative extubation with Dr. Husel, correct?
yes,
And that was not true, correct?
I believe the last one was in September.
Which was just a couple months before December, right?
Yes,
Okay. And you also told the detectives that you didn't give fentanyl, that you gave Dilaudid and Versed, correct?
correct. I thought I had given,
That's correct, right?
correct.
Okay. That turned out not to be true, correct?
Yes,
And then when you were asked, when did this occur, you told them that it had been done in the summer, correct?
summer or fall, I believe.
If I show you your statement, would that refresh your recollection as to whether you told them it was the summer only?
Yes, please.
May I approach?
Okay.
It might have been in the summer.
That's what you told them, correct?
Correct,
You didn't mention anything about the fall, right?
correct.
And after they stated that you had given Dilaudid and Versed during palliative extubations, and that's mostly what you could remember, correct?
Correct.
That turned out not to be true. Correct?
Correct.
Then, they asked you if you had any memory of giving any fentanyl, and you stated that you couldn't remember, and you'd have to look at your documentation, correct?
Yes.
And then they asked you if there were scenarios being asked about different types of doses for different types of patients. Do you recall that?
Yes.
And one of the statements you made was that you wouldn't give 500 micrograms of fentanyl to a little old lady, correct?
Correct.
Karina Blake was an elder woman, correct?
I believe she was in her 50s.
I'll get you that information in a minute, but it's your testimony that she was just in her 50s?
I believe so.
Okay, but you don't know for sure,
I think she was in her 50s.
okay? So, subsequent to that, you also told them that if you didn't feel the dose was appropriate, you would not give it, correct?
Correct.
And then you told them the steps and the things you would do should a doctor ever give you a dose amount that you did not agree with, correct?
Yes.
Then at the very end of your interview, Detective Kroon asked you if you had any questions for them, correct?
Yes.
And you didn't have any questions for them.
No, I did not.
Now, that interview lasted until 10:15, correct?
Yes.
So it was only 10 minutes, correct?
Correct.
Where you had told them you didn't have any memory of giving any fentanyl, correct?
Yes.
You told them when you did an extubation with Dr. Husel, it was
Objection, Your Honor.
Dilaudid and Versed, correct?
Asked and answered sustained.
Now, after 10:15, you were then called back by the detectives 30 minutes later, were you not?
Yes.
And you're aware that you're the only person spoken to that was called back, correct?
I was not aware.
I'm sorry?
I was not aware that I was the only one called back.
Objection, Your Honor, since facts
Okay.
not in evidence.
Overruled. Move on.
Now, it's at this time that Detective Kroon and Detective Pennington had confronted you with information that they had now, correct?
Yes.
And that in fact, you gave 500 micrograms of fentanyl to Miss Karina Blake, correct?
Yes.
Now, they didn't have her name, correct?
Correct.
And then they asked you if you remembered anything. Do you remember that?
Yes, I remember.
And it's at that point that you said you didn't remember the patient and you have no more information, correct?
Correct.
Now, that was on December 8th. After you left that second interview with law enforcement, you broke down and cried, correct?
I did. Yes.
And December 8th was a Saturday?
Yes.
That's fine. I can show one for September 22nd. Sure. Okay.
Now, I'm showing you a calendar of December 2018. Do you see that? And that is Exhibit RNKM2. Do you see that, ma'am?
Yes.
Now, December 8th is a Saturday,
Yes.
okay? Now, the following Monday, I presume it's at that time you got yourself a lawyer, correct?
Yes.
Objection, Your Honor.
And
Okay. Relevancy?
I'm tying it together.
Okay,
Judge.
tie it
So-
together quickly.
And it is then on the 13th that you had a proffer with the state attorney's office, correct?
Yes.
And present there was the elected state attorney of this county, Mr. O'Brien.
Yes.
Also present there was his first assistant, Mr. Jimmy Lowe.
Yes.
Also present there was Detective Kroon again, correct?
Yes.
And also again was Detective Pennington, correct?
Yes.
Now, within within 3 days, you got yourself a lawyer, correct?
Yes.
Your lawyer reached out and managed to set up a meeting with the elected state attorney, correct?
Yes.
And
Sustained.
in addition,
You should,
I'll move on, Judge, I'll move on. And in fact, the two of you, the two sides, you're, on behalf of you, it was set up to get what's called a proffer letter, correct?
Objection, Your Honor.
do you know?
Yes, that's correct.
Okay. And this would lay out the conditions of what can and cannot be used against you, correct?
Yes.
And it's at this point that you decided to be a state cooperator, correct?
Yes.
And as part of your cooperation, the first thing you had to do is go in and have this meeting, correct?
Yes.
And the very first thing that you discuss during this meeting is the palliative extubation of Karina Blake, correct?
Yes.
And now, you remembered that she was a homeless woman, correct?
Yes.
You remember that she had gotten intubated, correct?
Yes.
You remember that she needed a bunch of medications to keep her alive?
Yes.
You remembered that that the prior nurse had told you she was probably going to code?
Yes.
You remembered that she was still in full code status?
Yes, she was.
You remember that that you had talked to your charge nurse, Ms. Ann Irwin, about making her your only patient for the night.
Yes.
And that's because you remembered she was very ill.
Yes, she was.
You also remembered that she had max pressors.
Yes.
And you also remembered what her blood pressure was. Correct?
I don't understand the question. Like where her blood pressure was?
Correct. That her blood pressure was low.
Yes, it was low.
And you remembered that she was approximately somewhere around 50 micrograms a minute on Levofed, correct?
Yes.
And you remembered that you had an orientee with you, correct?
Yes, I did.
And you remember her name was Lauren Schlasser,
Yes.
okay? You also remembered that you needed to put a board behind Ms. Blake's back, correct?
Yes.
You also remember that board, that you also had to put, I guess, something on her to shock her?
Yes.
You remember quite a bit of details rather than me getting into all of them, right?
Yes.
When just a few days earlier, you told the detectives you couldn't remember a thing, correct?
Correct.
You told this jury that a nurse is not supposed to lie, correct?
Correct.
Now, but that's to a patient, correct?
Correct.
You don't think it's okay to lie to detectives, homicide detectives, do you?
No.
And part of your cooperation, also, what you did basically was show them all of the text messages that you had with all of the other nurses, correct?
I did.
And all of the communication between all of the nurses and you, correct?
Yes.
And you talked to them about all the phone calls you had with all the different nurses, correct?
Yes.
You basically talked to them about every single nurse that you had contact with.
Yes.
And the content of that information, correct?
Yes.
Now, Ms. Karina Blake's palliative extubation was in fact verified by the pharmacy, correct?
It was.
They approved it, correct?
Yes.
I'd like to show you Defendant's Exhibit CB1, page 634. Do you see that the order was given at 20:05?
Yes.
That's 8:05 in the evening?
Yes.
And it was verified by the pharmacist 5 minutes later?
Yes.
And it wasn't given until 12 at night, correct?
That's what it looks like. May I explain why that happens?
No, I'm sure you can explain yourself with Mr. Zion. He'll ask you some more questions after I'm done. Now, this is when you also started to well, let me rephrase that. When you reached out to the prosecutor's office, you informed them that you had more information to give them, right?
Yes.
And since you are now a state cooperator, you informed them of, that's the first time you brought up about this.
Characterization, Your Honor?
Sustained.
I'm sorry, Mr. Zion, I didn't hear you.
He objected to the clarification as the identification that she was a state cooperator or something along that line.
He used that word, Judge. State cooperator is the word he used.
Yeah. Sustained.
While you were cooperating for the state, you gave them
Sustained.
information. You gave the prosecutors information, or this was the first time you mentioned this 24 of 24, correct?
Correct.
And apparently there was a talk that he gave before, right?
Yes.
And a talk that he gave after, right?
Yes.
The problem is, you never, ever, ever heard Dr. Husel speak to a family for a palliative extubation, correct?
I don't think with the new talk. I don't know if I've heard it for the old talk.
Well, the extubation you did with Dr. Husel, it was the resident that went in and had the conversation.
Yes, that's correct.
So during that extubation, you didn't hear him say a word, correct?
Correct.
And then he changed his talk, according to you, correct?
Yes.
And if he's 24 for 24, why would he change his talk?
I think the 24 for 24 was after he had changed the talk.
You're aware that he's only given 30 extubations in the entire time he's worked there, correct?
Objection, Your Honor. That is not
Sustained.
evidence.
Well, let me ask you this. How many times in your employment, how long did you work there?
2.5 years.
In 2.5 years, you only did one palliative extubation with Dr. Husel, correct?
I don't know.
I recognize you might have issues with your memory, but you haven't
Okay,
told...
counselor.
Ma'am, you have not told, or during this proffer session that you had, you did not talk to them about any other palliative extubations that you had with Dr. Husel.
I can't remember any of the other ones.
My question to you, ma'am, is, during this entire proffer session, where you were basically given a letter that said basically, let me rephrase that. Part of this letter that you obtained was that what you said would not be used against you, correct?
Correct.
And you needed that before you went in and talked to them, right?
Yes.
And
Objection, Your Honor.
as part of this...
Okay, hold on. I'll permit it, but let's get to it.
Sure. So you had the opportunity to tell them everything you knew, correct?
Yes.
And you wanted to tell them everything you knew, correct?
Yes.
And you knew that what you said couldn't be held against you, correct?
Yes,
And you never told them about any other palliative extubations with Dr. Husel, correct?
I did not.
In fact, as you sit here today, the only palliative extubation that you could talk about is that of Karina Blair, correct?
That's the only one I remember.
Fair to say, if a patient of yours passes, that's something you probably remember, right?
Yes,
Now, you talked about this bromance. That's the first time you also brought up this bromance thing too, right?
yes,
And the fact is, you didn't like Mr. Deemer, Mr. Rudman, the two Mr. Rudmans that worked there because they teased you, correct?
I didn't mind working with them. I was there to do a job, I wasn't there to make friends.
But you didn't like that they teased you, correct?
I don't remember them teasing me. They might have.
They
I don't-
might have.
I don't remember.
Is Stephanie Lachard part of the bromance?
No,
Is Jamie Burke part of the bromance?
no,
Is Wesley Black part of the bromance?
I don't know for sure.
Is Jordan Blair part of the bromance?
I don't think so.
Ma'am, you testified a couple times that you liked Dr. Husel,
Yes,
but you liked yourself a little bit more, correct?
I don't understand the question.
You like yourself a lot more than you like Dr. Husel, correct?
She didn't understand your question.
I'll withdraw the question. Thank you, Judge.
Anything else?
Just one moment. No further questions.
Redirect?
Well, we'll call it State's Exhibit 100. Because I don't think we're up to that number yet.
We couldn't hear a word you said about the identification. I couldn't. Could you re-identify, please?
State's Exhibit 100, by stipulation, since we're showing calendars, and since you made the point, summer versus fall, showing you what's been marked as State's Exhibit 100, a calendar date from September of 2018. Fall or summer? Coretta Blake was extubated on the 25th.
Objection, Judge. She agreed that she said summer and not fall. Counsel's trying to insert that as fall or summer.
You got into it a ways I'm permitted.
Yeah. When did summer end, according to this State's Exhibit 100?
September 21st.
4 days, is that, so that's 1, 2, 3, 4 days before Coretta Blake?
Yes,
You cried after you talked to the police?
I did.
Were they mean to you?
No, I was caught off guard.
Did they scream at you?
No,
Did they threaten you?
no,
Let me ask you this. You ever walk into a room and talk to 2 murder police before?
no,
Were you scared?
yes.
How's,
You got on it. Overruled.
I've never heard the phrase murder police.
I've never heard this phrase.
Well, rephrase. Let's call them detectives what they are.
Homicide detectives from the Columbus Police Department that investigate murders?
That was my first time.
What was your state of mind when you walked into that room and realized you were talking to 2 homicide detectives from the Columbus Police Department that investigate murders?
I was terrified.
Did you try to cooperate with them?
Yes, I tried.
Were you so scared? Did you go out thereafter and engage the services of a defense attorney?
Yes.
Did you think about what they had asked you about?
Yes.
Did you thereafter meet with the detectives again voluntarily
Yes.
with your attorney?
Yes.
Did you sign any plea agreements or immunity agreements as part of this agreement to meet with the police a third time and with the county prosecutor?
I signed the proper.
A proffer letter,
Yes.
which meant it's off the record.
Objection. Leading.
I would agree. Let's rephrase it.
How was it explained to you what a proffer letter meant?
Anything that I would say would not be held against me.
Was it explained to you that it was off the record? It was an off-the-record conversation.
It was recorded, so I don't think it was off the record.
I'm sorry. We'll get back to that. We'll pull it back up here. Yeah, why don't you print that out? Oh, you need a computer. Okay. Yeah, it's just,
I got it.
I'm just trying to get the fact that it's off the record. At any rate, did you tell them the truth in that meeting?
As much as I could remember at that time, yes.
Okay. When you first met with the police on December 8th, did they give you the name of the patient?
No.
Did they give you the date that the patient was treated?
Yes, I got the date.
So you knew the date on the first time. Did they give you the exact medications that were ordered and the doses that were ordered?
Yes.
All right. On that first date,
Yes.
on December 8th, and that did not jar your memory as to what was going on?
It did not yet.
Objection to the leading, Judge.
Sustained.
Showing you what I've marked for identification purposes is State's Exhibit 101. What does that letter say regarding whether this is an on-the-record discussion or an off-the-record discussion?
To assure there is no
Now,
misunderstandings.
just, if you could review it and then say whether or not that refreshes your memory as to whether it says it's off the record or on the record.
It's an off-the-record statement.
All right, thank you. On December 13th, when you're meeting with everyone, did you still like and respect Dr. Husel?
Yes,
Do you recall signing a petition to support Dr. Husel?
I did.
Okay.
Is that,
We're getting into stuff that's outside the scope.
outside the scope, Judge? He asked about
Okay.
her, how much he liked her versus liked himself.
I understand that. It's outside the scope.
All right. Did you still support Dr. Husel at that time?
Yes,
Did you lie about anything regarding your experiences with Dr. Husel in that off-the-record discussion you had with the
No.
police and the county prosecutor? Did you lie about anything you said today about your interactions with Dr. Husel and what you observed in the culture?
no.
Thank you. Nothing further.
Okay, ma'am, you may step down. Why don't we take 10 minutes, guys?
Judge, I think we're out of witnesses.
You're out of witnesses?
We're out of witnesses?
Man, we're just
We
burning
are out of
through.
witnesses, Judge, so maybe we can wrap it up today.
Okay. Let's get started at 9 in the morning. Remember the admonition. Have a wonderful evening. Okay? I hear it's absolutely gorgeous outside. I may get to see it someday. Okay? But with that, have a wonderful evening. Remember the admonitions. We'll get started at 9 in the morning. And whatever coffee that was, I walked down the hall this morning, it smelled so good. I don't know what it is, but it just was one of those things that kind of want to take a turn. Okay? Have a good evening, guys. Be safe. pleasant, that's for sure. Have a good evening, guys.
You're welcome to the coffee, by the way. Yeah.
I didn't get any of it, I just got the smell. Mr. Zion, as soon as she's ready. Anything for the record?